There we go. That one, that one, that one, and this guy hiding, and right here. So muscles that are coming off the main surfaces of the scapula. We have the spine of the scapula is here. The spine of the scapula runs right through here. It's that big ridge you can feel. Above it is the supraspinous fossa. And below it is the infraspinous fossa. And then on the other side, on the anterior side, is the subscapular fossa. So the muscles of the rotator cuff come off of those main surfaces. The rotation muscles, internal external rotation, come off of those main open fields on the scapula. And there's a fourth one called the teres minor. And that little dude is going to come off of the lateral border in here. The names of these things outside of the teres minor are really pretty simple. Supraspinous fossa, there's the supraspinatus muscle. So the muscle name means above the spine. Infraspinous fossa, there's the infraspinatus muscle. Simple as that. Subscapularis muscle is the subscapular fossa. And then teres minor is the other one. So I typically hear them referred to as the SITS muscles, S-I-T-S. Supraspinatus, infraspinatus, teres minor, subscapularis. And if we go back to looking at the muscle insertions, so supraspinatus is right. Supraspinatus is right here. Infraspinatus is right there. This guy coming off here. Teres minor then comes up from underneath. And subscap is the lone guy on the lesser tubercle out here. So these three on the posterior side, posterior surface, supraposterior surface of the scapula, all inserted in the greater tubercle. And on the anterior side, coming up from underneath, is your subscapularis, which is the only one that does internal rotation. The other three do external. So if we go in and get rid of those three muscles, think what I want. It's for this. Alright, so once again, here's deltoid. We can hide it out of the way. And you guys can see a nice close-up of infraspinatus, supraspinatus, teres minor, and subscapular crawling in from underneath. Easy enough? Not too bad so far? So, by groupings, rotator cuff, 4 muscles. And you can look at glenohumeral motions, which we'll get to. But I want to talk about stabilizing the scapula first. And to do that, we're going to go with Thorx. Oh, beauty, look at that. So in this view, we've really resected all of our rotator cuff muscles. They're happily out of the way. And what we're seeing is a very superficial view of the back. What muscle is that sitting on top?
This is the chest.
That's the trapezius. It is a massive band of fibers. It does a whole lot of things. Now, its insertion point is really all along the spine of the scapula. Everything kind of flows up from that. Many people will get tightness and spasms right in here. Most people in here, if I put pressure there, it will feel uncomfortable. At the same time, if you release that pressure, it will feel better as soon as you're done. Likewise, if I can actually take it, most people carry their stress to the upper traps, which makes life feel a little uncomfortable. But those muscle fibers actually blend all the way down. So we refer to it as a lower, a middle, and an upper trap. We actually consider those 3 separate muscles. not three separate muscles, but three separate sections of that muscle. They all have different motions. Because if I fire these lower traps, it's going to tilt it down this way. If I fire the middle traps, it's going to pull it back and retract the scapula towards the spine. If I fire the upper ones, it's actually going to oppose the action of the lower and tilt it back this way. So let's hide that dude out of the way. Underneath, we have this pair of muscles right here. Rhomboid major, rhomboid minor. They go directly from the spinous processes out to the medial border of the scapula. They fire, they're going to retract it in to help stabilize that direction. You can slide them out of the way. Now, you get below that, and all of these are going to act more on the thoracic cage for breathing and respiration, and so we're off of the scapular motion. Superior side, four little bands right there called levator scapula. What do you think they do? They elevate it. So they elevate it, they bring it up, they directly bring up the tip of it towards the head. You've got another little dude hiding over here on the hyoid. He doesn't act on the scapula, but uses it as a base, as an anchor, to then act on the anterior surface in the front for swallowing mechanisms. So we can kind of ignore him. We're not going to worry about him right now. So levator scap, we've got right there. Now, so I'm going to bring it back up. Get rid of my trap again. Now, if I've got two sets of muscles that pull my scapula in towards the spine, you two should probably wake up. Thanks. Madison. All right. So, we've got two muscles that pull the scapula in towards the spinous processes. We've got to have something that pulls it the opposite direction. And in that, it's kind of a tricky thing to visualize. But you've got these finger-like bands that come out called the serratus anterior. So there's a whole series that are going into individual ribs on the anterior surface right through here. So they kind of wrap in around. And if you look at some bodybuilders, you can see how they get actually pretty identifiably cut. They shouldn't be if you're eating enough, but you know, whichever. Now, where the insertion point here is actually a little bit unique. It's, if I hide out this, you see how they come all the way in towards the medial border by the insertion of those rhomboids. They come all the way underneath. So, by grabbing here, they're able to pull that in and retract it, pull the scapula, and actually protract it away, pulling it by the farthest end back in. So serratus anterior works opposites, the antagonist to the rhomboid major, rhomboid minor, and middle traps of the middle fibers of traps. What happens when you tear an ACL? It hurts. What happens after you tear the ACL?
Muscle guarding.
Muscle guarding?
Well, there's muscle guarding, but we have some neurogenic inhibition. We have a muscle that's shut off. What muscle is shut off? VMO. VMO goes bye-bye. He doesn't want to come out and play anymore. If you injure the shoulder complex, the serratus anterior is shut off, much like the VMO is shut off with an ACL. So what does that do? Functionally, what do you think happens if I shut off a muscle that stabilizes the scapula?
It isn't protracted.
Some's going to go wonky, right? Leave it at that, sort of.